Welcome to the MCM Student Business Show hosted by Dr. Kevin Christie and Dr. Gage Winkels, with a special clinical segment by Dr. Mark King. The show for chiropractic students and recent graduates, designed to help you become a thriving chiropractor.
Welcome to the MCM Student Business Show. I'm Dr. Kevin Christie.
Dr. Gage Winkels.
And today we're going to dive into 5 questions. We have everything from marketing to business to clinical. We have a nice little segment with Dr. Mark King in the middle, and we're here to help you understand what it takes to grow a practice aside from just the clinical. There's a lot of different things that you need to understand, and we're here to help you out.
So, Kevin, what is the one thing you wish you had known about business when you graduated from chiropractic school?
Yeah, I think from chiropractic school, from a business standpoint, would be the importance of an emergency fund and sinking fund to help you make accurate decisions as you're going along. And so let's define a little bit. Let's start with the sinking fund, okay? You might have heard this as a slush fund. That's fine. But with the sinking fund, we're trying to plan out large expenses throughout the year that are not going to impact your cash flow, right? If I asked you to write a $3,000 check for a new table that broke, that might hurt cash flow and put you in a crunch. If instead you contributed to an equipment repair fund throughout the year, you have that money set away in a different savings fund. So it's going to be a separate account. So I'm going to say different account, right? We're going to have that probably in a savings account. You would take all the things you might spend money on: malpractice insurance, equipment repair, new website. At the beginning of the year, you want to just kind of add up all the things you might write bigger checks, right? So for the sake of math, let's say that ends up being $12,000 for the year. You would then, starting in January, move $1,000 over from OpEx, okay? So that's our operating account, operating expense account. We're going to move it right over to the sinking fund automatically, right? And so that would be $1,000, we'll just say $1K, that's moved over there, so that when that expense comes, you have it. You then move it from the sinking fund back over to the operating account, and then you write that check. And so the importance of a sinking fund is going to be instrumental in predicting your cash flow and really being able to sleep at night when you have to spend money that's outside of your normal expenses for the month. Now, moving on to the next one here, let's go right over here. Your emergency fund is going to be for what that actually says, right? Emergencies. This isn't something you want to touch. And what a lot of people say, whether it's Christine Odell or Greg Crabtree, a really good one is about 2 months worth of your expenses. So if your monthly operating expenses is $20,000, you'd like to have $40,000 in an emergency savings account. Takes time to build it up, doesn't happen overnight. If you open up a practice, there could be a situation where you have working capital. That's what that is essentially, or you need to build up to it. One thing I've learned from Christine Odell, she said, get $5,000 in there, then get 1 month in there, and then get 2 months in there. And that would be your emergency fund. And depending on how you learn things, you're going to have an operating account, right? That's your checking account. That's your business checking account. A sinking fund account and an emergency savings account would be the kind of core 3 accounts you'd like to have in a practice. And that way you can make accurate decisions with your money and feel protected in case something happens.
All right, Kevin, so question number 2 here today. As a new associate, what would be the most impactful marketing strategy right out of the gates?
Yeah, one of the things I really have fallen in love with, and I first learned this from Kurt Kimberger, who's one of our coaches, and I'm sure he learned it from somewhere as well, is the Allied Health Network. And I'm going to share a tool here. We actually have on our CSA digital dashboard, we have a bunch of tools, and we have one here on the Allied Health Network. And essentially, we want you to be a great doctor, right? And that's part of it, is being able to refer out really well. Like, part of being a world-class doctor is having a world-class referral network, and that's important. And you do that consistently, and then you also will build a referring partnership with other doctors and performance specialists that will refer back to you. And so we want to go out in the community and actually build what we call an allied health network. So these are going to be people that are related to health and performance for the patient. And when you go into a community, you may not have a lot of those doctors. You may have 1 or 2. And so what we put together here, and I'm just going to kind of show you, is an allied health network. And we have two tabs here. We have health and we have performance. It can be shown as cards like this, like Dr. Alan Jones. It could be on the performance side, you might have Sue Smith, who's a running and triathlete coach. And then when you go in here and you add a contact, right, you add a provider type. We have health. We have a bunch of different types of specialists. It could be the hand wrist specialist, the primary care doctor, all the way down to physical therapy, acupuncture, imaging centers, urgent cares, doulas and midwives, dentists with like maybe a TMD specialist. We have all these different types in here, and then we go down and we've got the performance. This could be running coach, triathlete coach, personal trainer, tennis coach, golf instructor. You get it. Like whether it's on the health or the performance, we want to build out this list. So what I would recommend as a new doctor going into whatever community, whether you're starting your own practice or you're working for another practice, is to work with either the existing practice or, again, if you're opening up your own, is build out a world-class referral system, this allied health network. It gives you a reason to go and meet other types of people, right? And so let's say you need to go find that knee and shoulder orthopedist because you treat knees and shoulders, and some are going to walk into your clinic, and you've been in practice now for a year and a half. Isn't that something that you notice, like you're getting certain conditions you weren't maybe expecting?
Absolutely.
And I think when you build this out, you can now have a good referral out. And then it also, again, you can build connections that will over time refer back to your practice. And so maybe you don't have the knee and shoulder orthopedist, but maybe you have a good foot and ankle specialist that you know. I would go and talk to that foot and ankle specialist. Who's the best knee shoulder specialist I need to know? That doctor gives you the name of the best knee ortho, and you contact that office, say, hey, I'm Dr. Kevin Christie. I'm new to the area, building out referrals for our patients, and I heard Dr. Smith was the best knee shoulder ortho in the community. I'd love to set up a time to meet with the doctor. Is there a good day and time that would work for you? So it becomes a kind of like a Trojan horse to get that meeting with the other doctor, right? On the other side of it, maybe it's you've got a tennis coach, but you need a golf performance coach, and you start building this network of people that you can now connect with on the health side and the performance side. And I would love for you to, this is just a demo one here, but I would love for this, if I go over here and you just got a laundry list of doctors and all kinds of health specialists here, you can tease this out by health only or by performance only. And then you can go in here and search, right? If you need to do knee, I don't have one in there, but it would pull knee. But let's say we were running coach. As I type that in, you can see it pops it up, and it becomes really good for your team as well. Like we basically stopped with the business cards, and what we do is say, hey, send so and so to Dr. Smith, and so our staff at the front goes on here, finds Dr. Smith, and then two-way text it to him, and then that was really good customer service as well. So that's what I would do, getting into the community, knowing what I know now. I would work diligently to build that. There's other things you have to do as well, but that would be a big focus of mine.
Absolutely.
All right, on to our clinical segment with Dr. Mark King of MPI. We've got one question here submitted by a student, and that is, can you give me one piece of clinical advice that every student should hear when they are in school? Mark?
Well, this is an important question because I've been asked this question in the past, and I had a lot of wide-ranging answers to it, but I heard an interview with Dr. Mike Leahy from ART not too long ago, and they asked him that question, and he said that you should try to become great at something. Now, at the Motion Palpation Institute, we are biased, and we want you to be great at palpation and adjusting and integration of other techniques. Dr. Leahy wants you to be great at ART. Maybe you want to become a neurology diplomate. Whatever you're the rehab expert, whatever the thing is, but become great at that, and then you can build on top of that. Again, our bias is toward the foundational skills of palpation and adjusting because that's what you're going to typically do each day, and then we want you to add these other things to that. But be great at something. That helps set you apart from other clinics in your area, sets you apart from other offices around the country. So that's the way where I would start, is that I'm going to become obsessed and fantastic at something and then build on it from there. I wanted to mention on March 21st and 22nd, we have our sports summit in Florida, in the Daytona area. And then in June 6th and 7th, we're doing MPI Disc in Chicago. So I wanted to mention those as upcoming classes that you might be interested in. Thanks.
All right, Kevin, so fourth question here of our first episode, talking about communication here. We had a submission. What is the biggest patient communication mistake you see with new graduates?
Yeah, there's a lot going on with that. You're on the younger side typically. You got to look at someone that might be 20, 25 years older, and you, with conviction and confidence, have to recommend a treatment plan. And I think the biggest thing that I see is under recommending care, under treating that patient. That patient comes in with something that might be going on for 6 to 8 weeks, and a lot of times a new doc is, let's come in a couple times, see how it goes, or let's do twice a week for 2 weeks. And really, if you look at the evidence-based care guidelines for treatment frequency and duration for a lot of these conditions, there needs to be a more substantial treatment plan to it. It doesn't have to be 6 months, but it might have to be 2 times a week for 4 weeks. It might have to be 3 times a week for 2 weeks, and 2 times a week for another 2 weeks, and then once a week for a couple weeks, right? And I think what I see chronically with the newer DC is the under kind of dosing of treatment on that. Now, what have you noticed as you've progressed over the last couple of years in clinic with that?
Yeah, I think, being a young DC, there's definitely the trust factor that needs to be built in there. And especially with older patients. I mean, it's still, weekly I get the question, how old are you? Or how long have you been doing this now, right? And so you need to present your treatment plan with trust in yourself, and I think that's the first thing. You need to know your capabilities and your ability to help that person. Yeah, that's huge. And then the second thing being that with evidence-based chiropractic care being more and more popular and taught more and more in schools, which I think is great for the profession. But you can't get caught up in chasing the pain, right? You can get a patient out of pain in 2 to 3 visits sometimes. Mm-hmm. That doesn't mean that they are then released from care at that point.
Yeah, that's a great point. And a lot of times we try to phrase that with them is, okay, the first phase of this is going to be pain relief. Right. Second is we're trying to build up injury resilience and correct the function. Because, ironically, a lot of evidence-based chiropractors will talk about not chasing the pain or focusing on function or movement quality, all those things which we all believe in. Yeah. But then they use pain as the kind of indicator of release from care or success.
Right.
And as we know a lot of times that pain will come back in 3 weeks or 3 months. And so we got to graduate them from, okay, we're out of pain now. Now you can do certain exercises or treatments that you couldn't do when they're in pain. Now you can have some fun and really work on the underlying cause of that. And so that's something that I talk a lot about. And I think the other thing is I always use the examples, like if a pro athlete, if an NFL player got strained his back, how often do you think he's coming in for care? Like probably every day, right?
Right.
Why is that? Because it works. It gets them better faster. Now, I understand the realities of like your regular patients aren't NFL players, but I'm just using it as an example of sometimes more frequency does get them better quicker. And if you asked your patient, would they rather come in 2 times that week or 3 times that week? If it meant shaving off a week of them being hurt, they'll probably take the 3 times a week. And you can use that as an example with the athlete. Now, obviously with regular people, there's money constraints, there's work constraints, there's a lot of things going on. So we're not necessarily saying you have to see them twice a day for 3 weeks like a pro athlete, but it just gives you an example of like, yes, sometimes more frequency early on with acute conditions does get them better quicker.
Yeah, absolutely. And I think, it's meeting your patient with their goals, right? If they have that upcoming race, coming up on a 5K or a marathon coming up, right? You may have to see them a little bit more frequently than you would if they were just dealing with some hamstring pain, and no rush to the treatment there.
And so build some confidence, work on it, really own Clinical Compass's evidence-based guidelines to treatment frequency and duration, and realize that you are setting up yourself for failure and potentially the patient if you undertreat them.
So, Kevin, our fifth and final question of this first episode here is regarding career development. Mm-hmm. And this is a big one that I relate to personally as well. What are your thoughts on picking one location upon graduation versus opening up options for different states or different cities to set yourself up for the best job and success in your career?
Yeah, and it's a reality, right? And I want to be cognizant of that, is sometimes you are going to be in a scenario where you have to pick the town or the city and then find a job. There's no doubt that's harder in many cases. Sometimes there's different things where you have a job lined up back at home, but oftentimes you're going away for undergrad, going away for chiropractic school, and then if you want to go back to a particular town or city and you have particular desires of the type of practice you want, because what you're trying to now figure out is, I've got to figure out a job that's a good job and congruent with my style of chiropractic. And that can be hard even when you open up the whole country, but then it gets really hard if you pick a town and you say, I want a sports chiropractic clinic that's going to compensate me well, and I've got professional growth, and it's got to be in wherever America, right? In one town. Like if you want to be in city, Indiana, like, and you're trying to find that exact perfect job, that gets tricky, right? Versus if you open up to states completely, or regions, or obviously the entire country. I would say the entire country might be a little bit rare, but oftentimes, we have an intern now. He was opened up. He gave me like a laundry list of 10 cities and states and stuff, and it helped, and he's got something lined up. Yeah. So we saw that there, and so it's going to be challenging if you're trying to find the perfect job at the perfect type of clinic for you in one town. When you open it up, you really open up to a lot of opportunities, and that was something that you obviously addressed.
Yeah, myself, being from a small town in northern Minnesota, it's about a 30-hour drive from where we sit here today. But upon graduating, I was in a position where, no ties to Minnesota there, no kids, no wife, nothing like that back home. So it was something that I really wanted to explore any and all options that would give me the best opportunity for growth and success in a career. And so that was something that I had to come to terms with. And it's not always easy. You can miss home, and I do at times, but home's always there for me. And I can tell you that I don't go a day, regretting that decision. And I think it depends on what your goals are, but when you kind of loophole yourself into that situation where, like you said, you want to practice in small city and specific state, and you want to have this laundry list of things that the practice involves, you really limit your options there. And so I would encourage, an open mind as you're graduating, especially as a young DC.
Yeah, and there's no right answer, and you got to take all the things into consideration. If you're just dead set on opening up your own practice out of school, then yeah, you can kind of go anywhere. There's going to be certain areas that are going to be better than others, but if you're going to do that, then you've got a little bit more wiggle room there. But if you are looking for an associate position, my recommendation would be, is if you have some wiggle room, is maybe start to pick an entire state, or at least a big part of a state, or a region. Yeah. And maybe there's similar areas. Like if you like the Midwest, then great. Like pick different areas of the Midwest. If you want a coastal town, start a list of those things, and then prepare yourself early on. I think the big thing that becomes a double whammy is when someone picks a town looking for a job and then didn't do enough while in school to start finding doctors. Like I wanted to come back down to South Florida, but I was open to it. But a year and ahead, I started coming down. Whenever I came down, I started shadowing clinics that were sports chiropractic clinics. And that ended up getting me an internship into a job, and then ultimately my kind of springboard into my career. So that'd be my recommendation. Start early in school, position yourself, and that will give you opportunities that maybe you wouldn't otherwise.
Yeah.
Now that you're getting a taste of understanding what ethical chiropractic business is all about, head on over to the Chiropractic Success Academy to check out our special student discount and continue your business development. You can visit CSA at csacircle.com to find out more.